Welcome back to Heart with Dr. Raj. I'm sure you guys have been researching PCSK9 inhibitors and what is all that about. Once again, you're listening to a board certified lipidologist. That's how much of a nerd I am and a passion that I have for cholesterol. So, PCSK9 inhibitors is a class of medicine that has been out for almost 10 years. Think about it. You could have been on this class of medicine 10 years ago, or you at least should have known about it if you're a diabetic or a high-risk patient or a heart disease patient or a vascular patient. So PCSK9 inhibitors will reduce the LDL by a further 50 to 60% on top of statins and ezetimibe. And the studies have shown that, guess what? Patients who were on statins and a PCSK9 inhibitor, combination therapy, had a 20% reduction in heart attacks and stroke. And patients who kept their LDL under 55 lived longer. The data is out. There is no more confusion about this class of medicine. The problem is nobody wants to know about it. Nobody wants to take this medicine. Everybody wants to do things naturally. And I told you, guys, natural is cool until it's not cool. So if you're a high-risk diabetic, high-risk non-diabetic, you have had a heart attack, you've had a stroke, you've had revascularization, peripheral arterial disease, you would benefit the most from a PCSK9 inhibitor. And remember, the two available injectable PCSK9 inhibitors are Repatha and Praluent. We've been using these medicines for over 10 years. And just now the oral version of a PCSK9 inhibitor just came out, and that is called Lipfendra. So I'm a fan of all lipid lowering therapy. I'm a fan of lowering the LDL, but it's just funny how everybody's excited about the oral version of the PCSK9 inhibitor when the injectable version, which is the auto-injector self-administered at home, has been out for 10 years and nobody's been talking about Repatha or Praluent. So I challenge the community. I think people are just excited about the buzz or the idea, but in general, in my opinion, what I've seen is people don't care to lower their cholesterol. How do I know this? Every diabetic knows their hemoglobin A1C by two significant figures. But if you ask a diabetic or a heart attack or stroke patient, they don't even know their LDL. I know. Think about that. Talk to you soon.